Hello, everyone. Hi, and welcome to my Lunch and Learn. My name is Stacy Nell. I'm the Executive Director of the Kansas African American Affairs Commission. And today I am thrilled. I am always thrilled, but I am especially thrilled to be joined by Dr. Sharla Smith. Hi.
Hi, it's great to be here. Thank you for the opportunity.
Charlotte and I were just honestly just laughing and talking and chit-chatting before I pushed record here, because you were honestly one of my first guests on the Lunch and Learn series when I first started this, like almost 2 years ago.
Wow. It
I
doesn't
know.
seem like it's been that long, but you've been doing an amazing job keeping the people in Kansas informed of the work that's happening across the state. So
Well,
thank you.
Thank you. And what we were talking about beforehand is when I went back to the agenda from a couple of years ago and pulled it up and was starting to update with information. And I want to take a second to give you your flowers here, because I was like, man, KBN has been doing some stuff. But we'll get to that. I should back up for a second, because it's been a couple of years since you've been on. People may not remember or may not know who you are. So let me read. Dr. Sharla Smith. Dr. Sharla Smith completed her PhD in Health Systems and Service Research with a concentration in Health Economics from the University of Arkansas in 2013. Dr. Smith is a health services and system researcher whose primary research is maternal and infant health disparities, women's cancer disparities, and community engagement. She's the co-founder of the Kansas Sisters and Brothers for Healthy Infants and the founder of the Kansas Birth Equity Network. And I know we're going to be talking a lot about the Birth Equity Network today. Dr. Smith is passionate about developing a culture of birth equity through community engagement, empowerment, and education. So, Dr. Smith, thank you so much for joining me today.
Thank you.
So it's a lunch and learn, and I always ask, what'd you have for lunch today? We're recording this well after lunch, but what did you have for lunch today?
Oh, wow. I had my leftovers of chicken minis from Chick-fil-A.
There you go. I had leftovers too. It was like chicken, and it was part of like a chicken taco thing. So now I think we're recording this in a time when I was originally going to say people are more aware of the health disparities for maternal outcomes for Black women in particular. And not to start this off too heavy, but there's been a recent death, right? There's been a recent death that's in the news. A former Chiefs cheerleader who passed away after complications after giving birth. So Dr. Smith, if you want to talk about that or share what you know or what, you know.
Yeah, every time that we have to have one of these conversations, I'm dreading the thought of it, or the family having to hear this over and over of something that's preventable, right? 80% of these maternal deaths are preventable. And she had infection and she died. And not only did she lose her life, but her baby, Charlotte, lost her life as well. And I think that, when we think about these things, what I've been asked by reporters is, what do you think when it's a healthy Black woman? I'm like, it's often a healthy Black woman. But this, young lady, she was a health equity advocate. And so what that means is that she truly knew the disparities, and she knew how to advocate, which is what people love to say, advocate for yourself. She had the resources to get health care, but somewhere the system failed her, whether that was in providing the information she needed or, I don't know where the failure was, and I don't know the breakdown of the care and all of that. I just look at the prenatal care schedule for appointments, and I'm like, did they miss something in that 16 to 20 week appointment? Like, was something missed, or was that appointment missed, or what happened, right? But oftentimes I'm stuck in thinking, but there's a family. Like, we bring attention to the former Chiefs cheerleader and her baby, but there is a husband, there is a mother, a father, sister, cousin. There is a family that is grieving a preventable loss in our community. And, not only that, but of course, in the state of Kansas, we have the highest Black maternal mortality rate in the first 42 days after delivery, right? And so, and the number one cause is mental health, but just the reality that we have that in a state that's not very diverse, right?
Mhm.
And that our Black maternal mortality rate is higher than the state of Missouri for the first time in history, and that Missouri decreased their Black maternal mortality rate and we increased ours, right? um and it's just sad to think that individuals don't care enough. Like it's hard to believe that people don't care enough, and and there's a small window of opportunity to get something done about an issue that is prevalent and has been for centuries.
Yeah. I mean, as a Black woman who has given birth to 2 children in the state of Kansas, I know that going into my first pregnancy, or my first birthing experience, because I had a pregnancy that I lost before that. But going into my first birthing experience, I was aware of the stats. This is well before I met you, but I remember reading about how, just in general, like America has like one of the highest maternal, white, Black, whatever, maternal death rates in the world, which floored me. Like, how is it that in America so many women are dying in childbirth? Didn't make sense. But then the Black maternal rate was crazy high. And I know there are a lot of people, and I'm sort of jumping the gun here and talking, and I've been paying attention to a lot of the discussion on the legislative level about maternal health rates. That I know for a fact, when I was pregnant and when I was getting ready to go into to have that child, I had the conversation with my husband, because I knew the odds were not in my favor. This idea of something starts to go bad, you follow the baby, right? Just leave me and you go make sure it's. And so this is very real. It's something that's
Right.
very near to me. It's something I think it's near to Black women everywhere. But to your point, there's a husband, right? There's a I know I've been to some of your summits where there's a mother, the grandmother, I guess, who's saying that my child died. So listen, I don't want to be too heavy. So let's talk about the Kansas Birth Equity Network. Let's talk about how you started the Kansas Birth Equity Network, and then what, because it has grown, right? And I'm looking over your
Yeah.
website. You have been doing this work. You are
Yeah.
making headway. So how did the Kansas Birth Equity Network start?
Oh, so the long history. Well, before we do that, I do want to pause and just acknowledge that you said that you had to have a conversation with your husband before giving birth to your second child, right? Um, and then, but when the third pregnancy happened, there was a child, right? And so that conversation is different. Like your husband thinking, if something happens, if something goes bad, now can I actually follow the baby? Or do I have to follow the wife? Because we have a child now that my wife is taken care of, right? She's already parenting. So I think in our legislation, when you talk about the legislators, they don't consider that those conversations change
Mm-hmm.
for the better of the family structure. And that should be something that they consider when they're making policy. But I just wanted to acknowledge that, and that it's hard to have those. We shouldn't have to have those conversations. We live in a very rich country. And so, why are we having to have conversations with our mate that we may not survive the most beautiful thing in the world, which is to give
Mm-hmm.
birth to a human being, right? That's unfortunate. But KBIN, so KBIN was actually founded out of a community initiative that Dr. Redmond and I started in Wichita, Kansas, called the Kansas Sisters and Brothers of Healthy Infants, where we engaged Black Greek organizations, graduate chapters, the Divine Nine, in a community initiative to increase awareness around infant mortality, then maternal mortality. And then, as we grew and as we did more work, we knew that we needed to engage more stakeholders and create a space, an opportunity to just focus on Black maternal health. There's oftentimes, we will make a space for everyone, but oftentimes as Black individuals share their space, with everyone else. And so we know that we needed to just have a effort on it, and just, be blackety black is what people say, and unapologetically that, until these numbers change. Like at some point we may go in a new direction, but that would mean that Black women aren't more at risk for dying, right? That would mean that everybody's at equality at least. But it started out of that, and it started as a PCORI grant, and just engaging stakeholders to create this network and to bring people together that were doing the same work, had shared visions and missions for the work, but we're doing it in silos. So to create that. And then also, KBN started so that we could stop dephasizing our community. Like I feel like, in research, and some of that is not our choice, but we always say marginalized, underrepresented, poor, single parents. Like it's always blaming behavior. And so KBN was really born to kind of shift that birth equity conversation and accountability from the mom and birthing person to the system policies and programs that were in place. And so we're really born to do that. And we started with I think 44 members, right? We started with 44 members, 34 active members, and now we have 130 members and growing. And so it's really great to see people come to the table and really want to solve the issue. It's diverse stakeholders. So that means what they do in the community, not their race. So we welcome everyone to be a part of what we're doing and to help us guide it. But I think one of the things I like so much about KBN is that it is truly community centered. And we are following the community's instructions and not just what the data says. So I think that's really important because your community needs to know that you're present and that you care and that they're being heard and listened to. And so we want to make sure that we do that.
And I think that might lead into some of the programs that you have implemented over the last couple of years. Like I was saying, in the 2 years since we've talked until now, I went back to read over the website and see what it was all the offerings, and it is impressive how many new offerings. So talk about some of those things that you've. I know, and again, I sort of know the answer, like the Dope Dads initiative or the mini grants. So were those born out of listening to what the community needed?
Yeah, I think absolutely. One of the things that we started was in partnership with you. We started the Crown Wellness Program, which was really, birthed out of the community saying there's nothing for fathers, right? And so your goal was to make sure like people were getting the knowledge and the truth about COVID-19 out to the Black communities, and Black communities were getting information they needed to make a decision, to make the best decision for them and their families. And our goal was like 1 in 10 men were suffering from postpartum depression and anxiety, and there was no attention being paid to it. So we saw our shared mission around educating and providing information and creating a health program in Black barbershops in Kansas. And so we came together, as a team to do that. And that funding was just 6 months. And those barbers still want to keep it going. So, it often our work is not just KBN, like it's straight from the community. And I would say you're in the community. So you knew this is something you needed to do. So we were able to partner with that. Dope Black Dads is something that Shalise Clay and Ladarius Johnson, who's KBN members, that they run, and we partner with them to move that agenda forward. We also partner with Queen's Village, which is also run by Shalise Clay, to move that work forward, which focuses on Black women. We have the BEST program, which is the Birth Equity Clinical Scholars Training Program, and that was birthed out of the fact that we had collected voices and patients kept saying, I'm not being heard, listened to, or seen within a healthcare system, and also hearing stories about your healthcare system that you're working every day, and so needing to address that. That program was birthed to increase the information that physicians had so that they could provide equitable care and give them some experience in providing care in Black communities. So
let's expand on that now, since you brought it up. So tell us about that program. So it's not, when you say I can increase increase awareness amongst physicians, but you're not just handing out a pamphlet to physicians. So tell us about how that.
Yeah, so it's a 2-year fellowship for OBGYN and family medicine residents. And it's also for MFM fellows. And so it's an application process where they apply and tell us about a birth equity project that they want to do. They are required to take our birth equity curriculum. They're required to attend didactics once a month around birth equity, and we teach them about, you've been a guest, we teach them about policy, doula, coordination of care, what doulas need from them. Like, we have really important conversations about coordination of care. They also have to spend 40 hours a year with a Black-led or Black-focused community organization to learn about the culture of the Black community and what community organizations are doing. And the community organization gets to decide what project they do. They do not do clinical care. They go as a learner. And then they have experience with policy. So they come to the Capitol, they meet with legislators, they have, open conversation about the policies they're making and how it impacts their practice, which we did this year is really great. And then they have a research project that they have to finish are complete, and their mentor team is their community person, a researcher, and a clinician. So it's really community driven. And they're residents, they're very busy, they're working so many hours a week, but they've dedicated their time to doing this program, and it's really workforce development. What I see as a big part of this program is that we're now working on the coordination of care of doulas and reimbursements of doulas for Medicaid. And by the time all of these policies are in place, these residents are going to be attendees. And so in order to really, truly make that happen, that implementation of coordination of care between clinical providers and non-clinical providers, the attendees need to sign on and agree with that. And so this program is not just workforce development for now, but is definitely going to prepare us as a state and other states who hire these positions to already be prepared to implement these coordination of clinical and non-clinical care to improve birth outcomes.
So this whole program is designed to sort of address, rather than address an outcome, like the outcome, right? We're trying to avoid this outcome, but to sort of back up, go upstream and say, what is it? If the system is failing, maybe we should teach the physicians who work within the system, hey, let's teach physicians how to not fail. So you're getting these people, like you said, as their residents. And they're OBGYN residents. And so I think that's, and how many years has this program been going?
The program, we're accepting our third cohort. So we're going into our third year of accepting residents. And we only accept, we max at 5. So we do 5 per year just because of the capacity of the program. And it's very new. We want to make sure they get everything that they need. And so we're going on our third year. I think it's, we have no funding, but we have a university that's committed to equity. And that is what keeps the program going.
I mean, so like you've already churned out 10 people and you're starting the next 5. But, if you think about how many lives an OBGYN will touch over the course of their practice, that's a lot of lives that could be saved, moms and babies, and a lot of families that are going to be impacted. So that's fantastic. And when I post this, I can post links to the website, and I'll have the information about this program. But I suppose if a person would just need to contact you if they're an OBGYN resident, or do you have to be a KU med student?
Yeah, so it is a KU program.
Okay.
And so you would have to be a KU resident to actually participate, but they would just apply. And the residents, it's a collaboration between the Department of Population Health, myself, OBGYN, and family medicine. So the residents of OBGYN and family medicine, they send it out to their residents for applications each year.
That's fantastic. let's get back to back it up and like where can we make adjustments in the system. Okay, so the one other thing that really meets the community needs is these mini grants. And so talk to me about the mini grants, because that's new from last time.
Yeah. So Healthy Blue gave KBN a $50,000 to fund community projects that address Black maternal and child and paternal health issues, and really address the gaps. And so most of those gaps are identified in our collaboratively developed research agenda. So they're answering those questions in their community projects. And what I love about the Healthy Blue funds is it's non-traditional. You don't have to write a grant. You can submit a video. You can just answer some questions. It can go to a community person or an organization. Now they have to be a part of KBN, but it's for the KBN members to really go out and do projects, and it just creates more collaboration, right? As a organization, KBN can't do all of the work. It's going to take all of us, and so those funds create that opportunity for all of us to get involved and do our part, and take a little bite off the pie, and try to improve health outcomes in Kansas. So
what like, I know you have, I think I can think of three, but like, what are some of the mini grants that were awarded?
Oh, it's great. Like the one that I love the most is the Laundromat Initiative. And I don't know why, but all of them are great projects. Don't get me wrong. Every project that we have funded or partnered with, we call it partnerships because it is a partnership. But the Laundromat Initiative was amazing because I never thought about how laundry would impact the Black family, right? And so the Laundromat Initiative allowed for free wash of 3 loads. It was hosted in Kansas City, Kansas, and washing powder and softener was provided, coloring books and crayons for the kids, food, information about the Kansas Birth Equity Network and other maternal and child health resources. But it was done on a Saturday, so it can make it convenient for parents. Also, that we offered bags, laundry bags. Like, we don't think about these small things, but if you are a mother, a father, a birthing person, and you're having to go to a laundromat every week to wash clothes for your family, who's taking care of that? Or are these initiatives done at a time that's convenient to you? And so
and laundry's a thing, because I remember that infant stage, because I had a newborn and like a 20-month-old at one point, and I felt like I was doing laundry. Either I was doing laundry all the time or I wasn't doing laundry all the time, and there was a stack of laundry that was talking to me like, why are you over there slacking? You know how it is. Yeah,
laundry's a thing. And going to the laundromat. I mean, as a child, there were moments in my childhood where we didn't have a washer and dryer at home, and we had to go to the laundromat. But we were older children, and so we were able to help my mom fold and wash. And we would plan our whole Saturday around going to the laundromat and taking care of all of the errands that need to be ran, and then back home to put up clothes and cleaning the house. I mean, it's a lot for families. Like, it's not just laundry. It's like you got to prepare for your week in 2 days.
So the Laundromat Initiative, was it a trap, like a portable laundromat, or was it like at a specific location?
No, it was at a laundromat. So there's a laundromat in Kansas City, Kansas that really invests in these things. And so we're hoping that more laundromats will open their doors for it. But that one was a great project ran by Kimberly Weaver. And then we recently had a project ran by Rodney Copridge. It was on paternal mental health, so paternal postpartum mental health. And it was an amazing event that really included a mental health specialist and 2 fathers and a grandfather. And they talked about mental health. But I think what I felt was so impactful was that the mental health provider said, if I had known that Black men were suffering, or Black fathers were suffering from postpartum anxiety or depression, it would have helped me provide better mental health care to the family structure. And so I thought that was just so impactful, that just that idea of knowing and having was great. And one of the other things, all the projects are great. So I can talk to you about all of them. We put about over $20,000 into the community to date. But we're going to have we're partnering with Black Dope Dads to have the first ever Black dad baby shower, which is centered around basketball. And it was in March, but we're moving it to Father's Day, or they're moving it to Father's Day. But it's going to be amazing to have an opportunity for fathers to come together. Our barbershop, one of the barbershops that in the Crown Wellness program is also collaborating. So he's going to be speaking. And it's just an amazing collaboration to see several projects that you're working with come together to create something that's never been created, and creating that space for Black fathers to just be Black fathers and to make something about them, because we do often leave them out of. I always tell people there's no D in MCH. Maternal and child health care has no D in it,
right,
or has no F in it. So,
I think it's so important that you're doing this work, and you've always spoken about this, right? Ever since I first met you, you've always spoken about this idea that you're taking care of families. Your concern is the family. I think so much of the discussion around everything having to do with reproductive rights and freedoms, and the entire reproductive process from conception to birth is focused on the woman. So I think it's even the reproductive freedom conversation, I'm like, are we ever going to talk about the fact that people don't get pregnant by themselves?
Absolutely.
Can we? There's a father involved. So the fact that you have ever since I've known you, you've always talked about this notion of that there is a father involved in all these things. And so often I think people unfortunately might make assumptions about Black fathers and their presence and their involvement, and that no, Black fathers are very involved.
Yes,
Black fathers
absolutely.
are extremely involved, and to not overlook them in this whole discussion of health, mental health, not just maternal health. Right. Now, this is a good segue, because one of the reasons I reached out and said, hey, we should do this week, is this weekend you have a program coming up. And so I want to make sure we leave time at the end to talk about this. It's happening this Saturday, and it's called Centering Black Mental Health, a conversation on mental health and parenting. So again, that's not just moms, that's centering Black mental health, parenting, and mental health. So tell us about the program on Saturday.
Yeah, thank you. Yeah, it's not just about moms. We know that mental health is the number one cause of maternal mortality. But we wanted to center it for the family. We wanted to center these conversations. So Saturday, it's at KCKCC, Technical Education Institute, our center. It's from 10:30 a.m. to 2. We have 28 vendors. So 28 vendors, Black business owners. So you'll be able to
KAAAC will be there, full disclosure.
And resources for our community. So, and that's very important. Like, this is a one-stop it's like a one-stop for Black families and all families. So we want everyone to attend. Like, if you look at the pictures of who attend, we have all families attend, but we want everyone centered on this topic, because it is when Black families thrive, all families thrive, right? Yeah. So we need everyone in the place. Dr. Tracy Johnson is going to talk about weathering and her own story. It's very, very impactful. And she's also going to talk about her approach to mental health and seeing her patients now with a mental health provider with her to address those issues. And she's an amazing speaker. She's absolutely a highly in demand for a physician and for a speaker out in the community. We do so many talks together, but we also have an amazing panel of experts that's going to be led by D. Rashawn Gilmore, who is the CEO and founder of Blackout, which really works on LGBTQ plus health, Black health. And he is a staple in our community for anything health equity, right? And so he also has a TV show on PBS. So he is an amazing speaker, and that conversation is going to be so great and such a wealth of information. Has Ethar in there. She's going to talk about being an immigrant and mental health and family structure. Todd's going to talk about parenting over the life cycle, like how you parent, parenting and mental health when you're postpartum, but then as your children grow and grow up into become teenagers. Mother Hakima,
I've got 2 teenagers now, and I got to tell you, I need some help.
Yeah, Mother Hakima is going to talk about her work in the community. Everybody knows Mother Hakima, founder and CEO of Uzazi Village, the best place to get care if you're birthing in Missouri, and just a great advocate for everything health equity. And then Marsha is going to be talking about being a community health worker and what she does, around mental health and where you can find culturally congruent healthcare. And so we're excited about that. But this event is everything. Everything's been taken care of for you just to show up and have fun. We will have swag when you check in. We have free daycare, so you can bring your children and enjoy the event. Daycare is ran by a licensed daycare provider in that county. We have food, so you can come and have lunch with us. We have Stacy there doing chair yoga again.
I will. And it's only, short. You only gave me like 10 minutes, but I can relax you in 10 minutes.
But if you see the pictures from last year with those, people were like so excited and so into the chair yoga. Like they were stretching and loving it. It's self-care. So that's our self-care component. And we'll have time with the vendors, right? And so everything you can think of is going to be there. We also have raffle prizes for parents who have children that are 5 or younger. And so you'll be able to enter a raffle. We have so many raffle prizes. Each one of the vendors is going to bring something. The community has been donating. CHC donated 6 things yesterday.
Okay.
The AKAACs, because of the recent loss of the Chiefs cheerleader, Crystal and her daughter Charlotte, they donated 2 gift cards. So the community has really stepped up, and this doesn't go to just Black parents. Anyone who's in the place that has a child 5 years or younger will be entered into this raffle, and you'll go home with a pack and play or a stroller or a car seat or a gift card or a basket. We have
that's something.
Self-care. KBN is giving away 2 self-care gift baskets, one for mom and one for dad. So we are really looking at mental health, but it's just a great opportunity to come out if you don't do anything but get to be around people that are like-minded and that care and that listen to you and see you and hear you as a human and as an individual in the community, and get some support of other parents. Like if you don't do anything but network, come out and support.
So I will make sure to have the link because it's free. But
yes,
you would like for people to
links
register.
are in the chat. They're coming up. So it's
Yep.
free. You can sign up for that to be a vendor. We're kind of full for vendors, so I doubt if a vendor. But if you want to volunteer, if you're a high school student and you want to volunteer and get some volunteer community service hours, if you want to sign your child up, and enjoy daycare. Sign them up. We need to know their allergies. They will also have food. We'll have food for the children,
for the kiddos.
Allergies before they come. And so everybody's going to be taken care of that day. Like we want to pamper to the community. We want you to feel like you're at a family reunion. You're at the kitchen table having a conversation about mental health and how normal it is to talk about mental health and to get help if you need help, and how to find support, right? There is support for everything. And I think that's what people will leave with. Like they'll leave with, oh, if anything happens, like I have support.
There's help out there. All right. Well, thank you so much. Thank you so much. I definitely wanted to, knowing that this event was coming up, I'm like, I want to do another lunch and learn to make sure that I could do what little I can to try to get the message out for people to know about this. Thank you, Dr. Smith. Thank you for the work that you do. Thank you for KBN. All the growth that KBN has had, even in the last 2 years, and the growth that KBN will have moving forward is a blessing to the community, not only to the Black community, but to Kansas as a whole. So I want to take a second to say thank you for the work that you're doing. And I will make sure that the links to KBIN's website, lots of resources, all the programs are listed out. There's links to even the community curriculum, like the curriculum and the resource communities, the dope dads, everything is on the KBIN site. I'll make sure that's in there, and to register for the event this weekend. So
yeah, and I want to thank you for this opportunity, and to just state that you are a KBIN member, so you are KBIN. So I thank you for your advocacy and for your willingness to partner with us to do some very impactful work in our community.
Man, I'll help you anytime I can. I am Team Smith. So.
And I'm Team Nail.
Okay. All right. Well, thank you so much, everybody. I will see you next time when we do our next Lunch and Learn. Have a wonderful day.
Have a great day.